son. Are you sure that's going to be okay?
I'm okay.
Because we can bump that in a little bit if we need to as well.
Let's ask some questions.
All right, so I'm rolling,
Let's
guys.
roll them.
Well, I want to thank you, first of all. And I know you haven't been on the job a whole long time. I'm not
Right.
gonna, you know, hold your feet to the fire on anything, but I definitely appreciate you making yourself available for opportunities like this, because a lot of vets have a lot of questions when it comes to healthcare, aside from what's happening in Cincinnati here just this last week. Here you're in a beautiful new facility. We've got a great director.
Yes.
Obviously good support staff. I personally got to visit this facility this last week and was pleasantly surprised by the care, and the facility speaks for itself.
Yes.
But
yes.
Access.
Yes.
Can you give our listeners some idea how the VHA in particular is looking to increase access to care for veterans?
Absolutely. Well, first of all, thank you for your service and thank you for doing this great radio show. I think the more that we can communicate what we're doing and the more we can inform veterans of their options and how we're trying to be responsive, the better it is. So it's great to be in Orlando. This is my first visit here, and seeing this facility has really had the same impression on me that you had, which is this is the type of care that veterans deserve. This is what we want all veterans to be able to experience. And the thought that went into this building and the type of professionals that are working here is really world class. So it's great to see that. But as you mentioned, access is really our #1 issue. It is most important. You can't get people in to see and get health care when they need it. You're not doing your job. And so that's our key across the country. So what I'm doing here today, what the director's doing here today, is that all across the country, every VA medical center is open seeing patients, because we are taking our lists of veterans who are waiting for health care that could be urgent and contacting every single one, making sure that if they need care that they can get care today, or we can move their appointments up to make sure that they're getting in to be seen as soon as they need to be seen.
So nationwide effort today to make sure if anybody's out there lingering in the bushes or waiting beyond 30 days, today's the day. This is a good push to make sure everybody gets seen.
This is what we call a stand down, which is we consider this a urgent issue. It's and of course what Americans do when there's an urgent issue is they act, and this is what we're doing. We had doctors and nurses here today in Orlando and in every medical center across the country coming in on their Saturdays to make sure that veterans' healthcare needs are being met. Now, I'm really pleased to say Orlando's in pretty good shape. I mean, we've been able to we started this effort with 850 veterans who were waiting greater than 30 days for appointments, and by the end of the day, all of them will have been contacted. We've already taken care of over 650, and we have probably a dozen clinics open today where veterans are being asked if they want to come in, and we're seeing patients. Our new emergency rooms open. If anybody needs care, they can come in today and be seen right away. I didn't see any wait when I was there just recently.
And you're speaking of the urgent care facility
Yes,
here.
that's right. That's right. You're
Which
accurate.
isn't quite an ER yet, but it's in.
Thank you for
that
correcting me. It's
transformation.
on its way to being an ER. It's so new. It's urgent care. But if there's anybody who has an urgent issue, this is, they can certainly come in and be seen, because we don't want veterans waiting because they think that there's access problems. In Orlando, I can tell you we have a good handle on this, and throughout the country we're working very hard to make sure that everyone's in as good a shape as they are in Orlando.
And as a physician yourself, you can appreciate if there's somebody out there waiting to be seen, and there isn't the physician or the number of physicians in a certain specialty to see those doctors. And I can attest to this personally through podiatry, my own personal issue, but it was neat because I got to actually see how the choice card worked. What kind of success can you share about the choice card as that final option to make sure that they get seen?
Well, choice is there when veterans are waiting greater than 30 days and we can't get them into the VA. We give that choice to see somebody in the community, or when they live more than 40 miles away from a center without a physician. But the choice program is there and working. We're using it more and more. It is not a perfect system, and we are having veterans telling us that they're having difficulty with it. We want to know about that. We have a great team here that they can call and if they're having trouble with choice, we'll help them with it or offer them appointments here at the medical center that we feel most confident that we can get people in. So every day we think the choice program's getting better, but it is still a system that we know people are experiencing problems with.
Right. I was just at Congressman Posey's roundtable in Brevard County, and that issue came up when they get the authorization. Again, this is the inner workings or the machinations of the whole program, but it is an issue. When they finally get the authorization, by the time they may even see their outside provider, it may have expired, so they go back through the loop.
Yes. We've gone to Congress and we've let them know that we are proposing a new version. We call it the New Choice Plan. We are committed to continuing to work with the community. We think that's important. But the rules and the way that this choice plan was set up is so difficult to use, so full of regulations and bureaucracy, that it's confusing for veterans, it's difficult for us to administer, it's not working the best it can. So we've actually asked for legislative changes, and we're very hopeful that we'll see them soon out of Congress.
And I'm curious from you, Mr. Lazard, on this level, when somebody goes through, when you have one of your physicians that says, for instance, let's say it's me, I'm not going to be able to see my podiatrist here at the VA for 5 months, so you're going to automatically make me a candidate. Is there a good understanding at the physician's level how that system works and to get them plugged in?
Yeah, we've gone through the rollout plans of implementing choice. We've educated our full medical staff on what's to happen after if we cannot provide an appointment in 30 days. And then working hard on educating the veteran on what will happen next as far as next steps, as far as getting a call in the next 3 days from the third-party administrator. The good news is that with some of these challenges that Dr. Shulkin has mentioned, Orlando's been identified as a pilot site for several initiatives. One is we'll be among the first to have the third-party administrator have staff embedded with our community care staff.
Can you explain that just a little bit?
So the third-party administrator has been, to this date, operating remotely in their own halls and walls, bricks and mortar, and housing their staff. And that sometimes fragments the communication. So our pilot is let us bring health net staff, the third-party administrator, into our organization, and let's facilitate some of the
Into these walls.
into
Yes.
these walls, where we locate the rest of our non-VA care folks. So the way that we provide care in the community is actually through 7 different programs, 7 different authorities. We have PC3, what is known as patient-centered care. It's a contract to provide. It's fee care. It's the choice. It's some relationships with other government entities, affiliations with Indian Health Affairs in some cases in parts of the country at a VA national level. So the Congress is contemplating, as mentioned, streamlining that into one community care program, one community care authority, and streamlining all of that. So our staff that manages all those outside community programs will have with them, under this pilot, the third-party administrator employee to help facilitate and work out problems with the choice implementation.
That sounds like it's going in the right direction.
We think so, yes.
Well, let me ask you a couple other questions, because one issue that's become prevalent, at least as far as we hear from veterans as far away as Oregon, Afghanistan really, but here locally, we're dealing with a lot of guys and gals that are chronic pain patients. And one anecdotal example, a Vietnam vet, he's been on a static dose of a pain medicine for 4 decades, and now he's being challenged by his doctors, not necessarily his doctors, but the pain management at the facility within the catchment area here at Vieira. And I just need to know what's happening there, because even though we can jump in and have effectively done so, working with some of the CMOs to get individual cases addressed, it seems like this is a wave that's coming. And aside from this idea that there's some Candyland within the VA where pills are just being given out, we don't believe that's true. We don't see the evidence. We know that veterans that are chronic pain patients sign contracts, and if they abide by them, it's a two-way street. The VA keeps up their end. But what can you speak about the fact that we see more and more evidence of the VA health administration coming down hard on prescribing medications. Let me throw this out. We've got another anecdotal example, but it's happening right now. Young man just separated from Army, end of December. He's waiting for VBA to get his benefits kicked in. So
Yeah.
VHA has come in and they've enrolled him, and
Right.
he's going in the right direction. But he hasn't even received one refill on his pain medications, which he's been on. He's an amputee from the war. He's been on now for over a year, and he's being challenged, and they want to titrate his dose down without offering any alternative. I understand you're at a different level, but here on the base where the physicians are interacting with the patients, what can you tell me about that?
Well, I don't know anything about the two particular veterans that you
Of
talked
course,
about.
but generally-
So it's hard. So let me tell you what I do know about. Pain is such a severe issue that no veteran should be sitting there in pain. So what is beginning to happen is that, and I think you're correct about this, there is now a huge national effort to try to avoid opioid dependence and look for alternatives where it's possible. Now, the good news is overall, and this isn't talking about your two specific examples, overall, VA is doing a better job than I think almost anybody. We are appropriately managing our opioid use. We've actually seen 16,000 less veterans on opioids than they were a year ago, so we've been able to get these numbers down. But when you do that, you have to do it in an appropriate way. You can't just withdraw opioids and have veterans in pain. You have to offer them alternatives. And so using different types of therapies in combination with opioid reduction to be able to give people better pain control is appropriate and is a best practice, and we're teaching our doctors how to do that. Now, it doesn't mean that it always goes well, and so that's where I think that people do need to speak up and say, no, my pain's getting worse, and it may be that the opioids have to be added on, or different types of pharmacotherapy have to be used in order to adjust the pain. But what we know nationally and what we know in the VA system is it's better to try alternatives before you get somebody addicted to opioids. So we use what's called a stepped up approach, which is stepping up the pain control with the opioids at the top of the list so that you don't get somebody dependent upon a medication that doesn't need to be. Just 2 weeks ago, one of our VA researchers has come out with what is very hopeful, the research that shows that there may be a non-addictive opioid soon in the offing coming out of the VA. That would be great news for us.
Oh, for sure, and I know that there's a medication on the shelf right now, tramadol, I think it
Yeah.
is, that is an effective analgesic for
Yeah,
a
but
lot
it's
of guys and
addictive.
gals.
Tramadol is effective and certainly part of the stepped-up approach, but it does lead to potentially addictive practices as well.
And just to add on, I don't want to beat this into the
Yeah.
dirt, but from Oregon to here, for instance, we've heard stories where once they get into this realm, this pain management panel realm,
Yes.
it's as if they're being challenged by a bunch of doctors and maybe
Yeah.
psychologists on this
Yeah.
team,
Yeah.
where their final recommendation is often, from what we hear, they're going to be sent to a rehabilitation facility, all right, and taught how to stretch and use swimming and other modalities to try and overcome their pain. When, if their pain is still an issue, those are things that are just upsetting this population of people, this population of vets even more.
Listen, this is very difficult. It's leaving people on addictive medications where there's alternatives, though, is not the best approach either, because as you begin to watch, what happens is they're going to get tolerant to that and they're going to need additional medications, and so it is somewhat of a cycle. So I think that the best thinking right now is that if there are alternatives to be able to help with pain control besides adding on to additional higher doses, once you start getting higher doses of narcotics, you get constipation and you get all sorts of other potential side effects. So this is very, very difficult. Once you're, if you have chronic pain, the worst situation that you could imagine, and certainly getting people relief is important, but having that be the ultimate therapy for the rest of their life, always, it is better to try to see if jointly you can come up with alternatives.
Well, and I've got a lot more I want to ask you, but
Yeah.
you only have so much time.
Yeah.
Let me ask you a couple other important things. The choice card was, I'm guessing, somewhat of a stopgap to make sure that they were seen timely enough, the patients, while you worked on your
Yes.
staffing issues. What kind of progress have we made in getting proper staffing of doctors and nurses
Yeah.
to fill facilities like this, and the recruiting and the retention of those doctors?
Yeah.
What are some of the problems
Yeah.
you see
Yeah.
in attracting these people, and what can the veterans,
Right.
because we're the ones that are ultimately served, what can we do to help you
Yes.
with that mission?
Yes. Well, I think this is a key issue for VA, but it's even beyond VA. It's actually what we're seeing throughout the whole healthcare system, which are shortages of doctors and shortages of healthcare professionals. And we see it differently depending on the geography. So Orlando has actually done a great job attracting high-quality healthcare professionals who want to work here at the medical center. When you build a new building and you have a beautiful facility, people want to come and work there,
Sure.
and also the type of culture that the director has been able to establish is a very positive culture here. But still, even here, we have difficulty recruiting psychiatrists and psychologists and primary care doctors, and there are a few others, healthcare professionals, that we also are in desperate need for as well. So we're always recruiting. And as you said, retaining your best healthcare professionals, it is very competitive because everybody out there knows the VA has great healthcare professionals, so they're trying to recruit them, and so we always have to work hard to retain our best healthcare professionals. But across the country, we have 43,000 openings
43,000.
in the VA. But what's worse is that our applications for jobs are down 78% from before the crisis in Phoenix. So all of this negative attention, people reporting all these negative stories on VA, everyone attacking VA, has actually harmed the VA healthcare system and harmed veterans in that way, because people are afraid to come to work here. And until they walk in the door and they talk to our healthcare professionals like I've been doing all day and see what a great place this is to work and how you can be so fulfilled by giving back to veterans, they don't see it. We're worried that people aren't even applying and entering the door and talking to us. So the help we could use is from veterans and from the public is to say, look, VA is doing great things and VA needs your help, and this is a great place to work, and at least give us a strong look when you're making your decision.